Welcome. Today's Practice Advantage Pearl is about things that might keep you and your colleagues up at night, the restless nights when you're thinking about the business aspect of running your practice. Now, you're not alone in that, and what we've been doing over the past several years at Practice Advantage is documenting our dialogue with practice administrators and physicians on the business side of things to get a better sense for what kinds of things are truly on your mind. One of the topics that we address oftentimes with that is looking at leadership and governance. Those are the topics that represent how the practice is being run from a senior administrative level or a partner level. The topics today, it's about 10% of the time that we're hearing about merging groups, health system integration, compensation structure, and those kinds of things. The trend there has been upward in the past several months. Part of that, I think, is the positioning for healthcare reform, and part of that might also be looking at how do we absolutely assure ourselves that we're going to be viable for whatever the future might bring, knowing that reimbursement may in fact be flat. Another topic that we address oftentimes, and this is one of the most frequented topics, is planning and marketing. The strategic plan, has that been updated? How are those referral development plans going? When's it time to add another provider, or what level provider might we add? A number of those strategic planning and business planning initiatives are on the minds of people day in and day out. The next topic goes without saying. Business and clinical operations represents about 18% of the dialogues that go on. And today's number one topic is that whole lean thing, Lean Sigma. How do we get people more productive? How do we take out some things that maybe are adiaphoric or unnecessary? Leveraging people like non-physician providers to help with productivity on both the clinical side of things and also then looking at revenue cycle improvements on the opposite side of things. Of course, there's finance. Practices are worried about keeping the viability of the practice going, and about 16% of the practices discussions have to do with finances. Again, there's that revenue cycle focus. Are we really capturing what we need to capture from a revenue side of things given flat reimbursement? Or maybe your accounts receivable is what you think to be out of control and you want to get it down under 18 days. Another piece is patient responsibility and time of service collections. How do we optimize that with higher copays and deductibles, federal savings accounts? Next is human resources. Pretty important, and the trend has been more and more discussion around human resources. Employee satisfaction has been dropping a bit because it's less is more, fewer people doing more work. There's been a shift in how you allocate benefits to these people, given that the expense for benefits is so high today. So they're feeling some burden around more work. They're feeling some burden around decreased benefits, perhaps. And also, they're looking at the past several years, we haven't gotten a raise from CMS or Medicare, and certainly we haven't been able to do what we've wanted to do with our employees as well. Next is information management, about 12% of the time, and today's discussions are around implementing, upgrading, or changing EMRs for the most part. A lot of people today are worried about making sure that they're compliant with some of the meaningful use criteria, e-prescribing, causing them to think about maybe changing their EMR or at least upgrading. And also in this category is the emerging need for outcomes data. Not that it's not been there previously, but in the possibility of going to a fee-for-value world, certainly outcomes becomes more important. Lastly, compliance and risk, making sure that people are compliant with HIPAA regulations, meeting meaningful use, and in some practices, some specialty practices, assuring that patients are compliant with their regimes by having drug screening protocols and those kinds of things. All of these different domains are the kinds of things that keep your colleagues up, keep yourself up perhaps at times at night. One thing that I'd like to interject here is the groups that are thinking about these things and dialoguing about these things are typically the groups that are better performers. They're the ones where you walk into the clinic or you walk into the hospital and you can feel it in the water, you can feel it in the air. It's one of those situations where you know things are working well in that particular practice. People in the practice are confident about their leaders. They feel like there's integrity there. So the question I would put out to you is, are you one of those practices where you can see it in the water, feel it in the air, or there maybe there's some things you can do, get back into the dialogue and include people in your practice to see if you can take it to that next level. Thank you for listening to this Pearl. I hope that this has been helpful, and I encourage you to go to the Medtronic Practice Advantage website to find out more. Thank you for your time.